Good morning, everyone. I'm David Snyder, President and CEO of the Economic Club of Chicago. Thank you for joining us today for a very important installment in our Chicago Conversation series, this one examining mental health and trauma. We're fortunate today to be joined by a distinguished panel, all of which bring different perspectives on the toll trauma and mental health is having on every Chicago neighborhood, suburbs, age, group, race, and employer. Our goal today is to learn more about solutions and opportunities that can help change this story for all of us. Now let me introduce our panelists. Eddie Bocanegra is Senior Director of the Heartland Alliance's READI Chicago. READI Chicago is an evidence-based and trauma-informed program to reduce gun violence and promote safety and opportunity in the city. Dr. Burnett-Zeigler is an Associate Professor of Psychiatry and Behavioral Sciences at Northwestern University's Feinberg School of Medicine. She is a fierce advocate for eliminating mental health stigma and normalizing participation in mental health care. Inger is also a member of the Economic Club. Dr. Colleen Cicchetti is Executive Director of the Center for Childhood Resilience at Lurie's Children's Hospital. CCR focuses on providing access to mental health services for children and adolescents. Eileen Mitchell is president of AT&T Illinois, one of the state's largest employers. AT&T of Illinois is also on the leading edge of addressing mental health challenges faced by its workers. Eileen also serves on the board of directors of the club. And moderating today's panel is another ECC member, Mark Ishaug, CEO of Thresholds, one of the state's oldest and largest providers of mental health services, providing health care and housing to 10,000 clients throughout Chicago and the Collier counties. Please note that today's program is being recorded and will be posted on the club's YouTube channel soon. We encourage you to share club content with colleagues and business partners and also post on your social media channels. We'll begin today's program with a brief opening remarks by Mark, followed by the panel discussion. During the program, please submit your own questions using the Q&A button at the bottom of your screen. Throughout the conversation, Mark will ask some of the top-rated questions submitted by members. So now, I turn things over to Mark.
Wonderful. Thank you, David, and good morning, panelists, and good morning, everybody out there on the internet. It's so great to be with you, especially the four of you this morning. I know I tell you this all the time, but you are friends and heroes of mine, and I love you to death, and I'm just so grateful for everything that you do for the sum of us here in Chicago and Illinois and the state and the world, in fact, just making such a huge difference every single day. So as David said, we're going to talk about a lot of the challenges that we face as a city and as a state. And we're going to focus on solutions and opportunities and hope and inspiration. So while not being Pollyanna here at all about the challenges that we face, we really do want to focus on what we can do individually, collectively, as communities, as business leaders, as educators, nonprofit leaders, and more. Because while the problems may seem intractable, there are solutions, and really good solutions. They may be micro, they may be macro, but there are solutions, and you all are part of the solution, as are most of the people listening in here today. So we're going to get right into it. As David said, we're going to have some questions for you all, and then we're going to have some audience questions, and then we're going to end with a quick round robin of self-care. I want to hear in 30 seconds each, like how you are taking care of yourselves. And then we're going to end with another 1-minute speed round of recommendations for club members. You all know these club members are doers. They got to get stuff done. So 1-minute set of recommendations about what people can do at 12:15 and after today. So to get right into it, again, thank you. So we bandy about the terms mental health, mental well-being, mental illness, trauma. So I just thought maybe for level setting, it might be good to start with our two clinicians, Inger and Colleen. Can you just sort of help us sort of understand sort of what these terms mean and what they don't mean as we're having a discussion today about mental health and trauma? Inger, I'm going to start with you, okay?
Sure. Thank you so much for that question, Mark. It's such a honor and pleasure to be here with you and the rest of the panelists this morning. Stress is something that we all experience at some point in our lives. And certainly, many of us have experienced stress over the last 2 years while coping with the pandemic. Chronic stress can lead to mental health conditions like depression, anxiety, and PTSD or post traumatic stress disorder. I want to specifically talk about traumatic stress, which is something that we clinically define that is experienced by people who have been exposed to a shocking, scary, or life threatening event. Some common examples of traumatic events are things like childhood abuse or neglect, emotional, physical, or sexual abuse, traumatic grief or separation, which so many of us have experienced in the context of COVID, community violence, such as gun violence and police brutality, war and terrorism, or serious accident or illness, which again, so many people have experienced over the last 2 years with COVID. After trauma, most people experience stress that goes away. However, some have symptoms that persist and can develop into PTSD, where they have symptoms like flashbacks, finding themselves avoiding reminders of the event, feeling numb, on edge, or angry. And I want to underscore that the risk for developing PTSD is higher among women and among Black adults. Women who have higher incidences of sexual violence, as do Black adults have higher incidences of sexual violence, as well as childhood abuse and neglect. While these clinical definitions of trauma, I think, are important in terms of setting the stage, I want to also widen the lens to think about trauma broadly, including intergenerational trauma, experiences of trauma that are repeated in families, such as childhood abuse, sexual abuse, domestic violence, and the like. Racial trauma, which is defined as the stress that one experiences when they repeatedly encounter racism, discrimination, or hate crimes. And we know that there's been a significant rise in hate crimes over the last couple of years. Similarly, vicarious exposures to trauma or secondhand trauma, which I have seen clinically so many people talking about in my clinical practice, as we've seen these really difficult images of violence being replayed repeatedly on the news and having a significant impact on one's mental health. And a term that my team has called subthreshold trauma, that those traumatic symptoms that fall right below that clinical definition, but can still significantly impact one's mental wellness and ability to function day to day.
Well, thank you for that, Ingrid. That was fantastic. Colleen, can you jump in here and talk, though, about the difference between trauma and distress or stress that maybe everybody on this Zoom is feeling a little bit of today?
Absolutely, yeah. So I appreciate Ingrid gave a really comprehensive definition of what trauma is, and certainly highlighting that we've moved beyond just those intrafamilial stressors, and really there's broadening understanding that trauma does affect us, even if it's shared in the community. It's not just what happens to you as an individual, but as a family or as a community. So I think that's really important in the current context. So when we think about trauma, I think it's really important for many of us that are trauma experts, including some on this panel. We've been trying to gain awareness and make people understand that trauma is serious and can have a long-term impact. But we're also trying to be very thoughtful about how we use the word. Right now, it's being thrown around in a lot of contexts, everything from the trauma of a bad traffic or a bad hair day if you have a teenager at home, right? So we want to be really careful when we talk about trauma that that's not what we're talking about here. When we think about the pandemic, for example, lots of people are saying we're all traumatized. And I would just caution us to think about that a little bit differently. We are all stressed by what we've experienced. We've all had moments, important gatherings, things that are critical to our sort of professional and personal identification disrupted, and that's stressful. But then there are a group of people for whom that stress has really become toxic. It's not just a one-time event, it's multiple events. It's the isolation has led to increased episodes of domestic violence, reports of elder abuse. We've heard lots of kids describing abuse. So we know that the stress that's happening for some is truly toxic. And that could include worries about food security or home security or employment. So we know that there's that group. And then there's a group that really does meet the criteria that Inger just mentioned. And those are the kids and the families who've actually experienced true trauma during this time. People who've lost loved ones without being able to say goodbye, or people who've seen people die in their homes, people who've had experienced true trauma. So I think the reason this is so critical is not that we do want to make sure everyone understands that the community as a whole is under stress. But when we start talking about some of the innovative programs and how do we match the needs and create responses to this, it's really think about this is not something that is occurring across 100% of our population, nor is it happening equitably. As Inger mentioned, the more types of trauma you've experienced, the more likelihood that you're going to have a long-term impact. So if you live in a community that's got chronic exposure to violence or disinvestment, the likelihood is that you will have more traumatic symptoms. So as we think about these solutions today, we want to think about what are we doing for everyone in our community to support them, but also how are we targeting the families, the communities that need the most resources, and we can help the most by directing those responses.
So thank you, Colleen. Two of the issues on everybody's mind, I would argue right now, probably everybody listening in on this Zoom, are the challenges that we face in our schools broadly defined, I would say K through 12, and our universities and colleges in Chicago and throughout the land, and of course, crime and violence. I'm going to come to Eddie, but I'm going to start first with Colleen again. If Colleen, could you talk from your perspective, sort of what is today, if you will, the state of mental well-being in our schools writ large, and what specifically is being done to support the students, the teachers, the parents, the communities, and these schools. So whatever good ideas and suggestions you have, again, solutions, optimism, and hope, despite the enormous challenges in our schools. And then we'll go to Eddie after that.
Sure. And I think it's important to remind people that prior to the pandemic, we did not have adequate mental health services for kids in our communities. So we believe that about 25% of kids in our country who need mental health services ever talk to a mental health professional. 25%. We also think that about 75% of those kids never make it to a clinic like the ones at Heartland or Northwestern or Lurie Children's. They talk to a mental health professional in their school. So what we know is that schools are sort of a de facto mental health agency, which is really important to recognize because that's not how schools were built. And that's not the charge of schools. And yet we know that's where kids are, and we know that's where many of these services are. So for Lurie Children's, what does that mean is that we can wait until kids show up on our waiting list or our emergency room and provide them with excellent services. But at the end of the day, most kids will never get there. And most kids shouldn't get there. What we need to do is build a system in which we're identifying kids who need services earlier in life, earlier in their symptom pictures, and getting them the services they need where they live, learn, and play. And the way to do that is not just creating hospitals, but also creating community-based programming that really thinks about all the adults that work with kids and what we can each be doing to help promote their mental health and wellness. So it's not just limiting it to the school social workers, school psychologists, or counselors. It's saying it's the role of teachers and parents and youth leaders and Girl Scout leaders and soccer coaches. All of us who work with kids have to have some understanding of what it is to promote mental health and wellness through social emotional learning. Our state happens to have the earliest set of those in the whole country, so we know those are out there. But making them a priority in a school setting when there's so much going on and so much pressure, especially with the history of learning loss that we've experienced, it's really tough. So what we're hearing from educators right now is that they see that the mental health needs that they saw before have multiplied. They have even greater needs, and they feel ill-equipped. They don't know what to do. They don't know how to meet these needs, and they don't feel like the systems in place are adequate. So what we're really seeing and happening, especially in Chicago, but now it's really taking force across the whole state, is a willingness to think differently about how do schools function as a hub for mental health and wellness, not just by their own personnel, but by inviting others in through partnerships, by thinking about the out of school time differently, equipping those people who work with kids in these informal settings to build social emotional skills, to build those relationships with adults that are going to allow kids to come forward and say, I need help, I'm struggling. Or for parents to know, who can I go to, whether it's the pediatrician, the teacher, the school social worker, the principal, and say, my kid's struggling and I don't know what to do. Where can I go? And we're trying really hard to build that capacity through a bunch of different initiatives and through a bunch of different efforts across the state to really think about differently those roles. And that's, I think, an important part for people to know. We have solutions, but one of the biggest challenges that this group can think about too is that in the past in Chicago, many of those gaps were being filled by philanthropy. We have either federal grants that come in or donors who come in and give us solutions for a few months. But at the end of the day, insurance and mental health benefits through Medicaid and private insurance are not adequate. There's not parity. And so we are not seeing mental health being covered. And so we're trying to fit these gaps by these innovative things that come and go quickly. And we really need to be thinking both, how do we equip these adults right now to support kids, and how do we build a system that's going to help pay for those services on an ongoing basis and not be hit or miss when the grants come or when the attention is no longer on this crisis.
Yeah, thanks, Colleen, for that. And we're going to swing back in 15, 20 minutes on what I describe as structural, systemic, and political solutions. Philanthropy is awesome, and thanks to all the philanthropists out there.
Absolutely.
They
help us be innovative.
Work
yeah.
and make them better, because we could not do what we do without private philanthropy. But these big systemic challenges require changes in how corporate America and corporate Chicago invests in its work, and how the government, especially for safety net populations and schools and disenfranchised, cannot thrive with philanthropy alone. So I'm going to pivot to Eddie. Good morning again, Eddie. Welcome. I think it'd be really helpful for our listeners to sort of understand better what we describe that are doing this work as the causal relationship between trauma in communities, individual trauma, community trauma, and violence and crime in Chicago. And if you talk a little bit about the really interesting and innovative, spectacular work, in fact, of READI and your partner agencies, and how you're using trauma-informed practices to, in fact, address trauma and the violence caused by trauma.
Thanks, Mark. Well, let me start off by just kind of briefly describing what READI Chicago really is. And it's an intervention initiative that was really designed and tailored to work with the highest risk individuals that are more likely to be victims or perpetrators of gun violence, which typically tend to be male, 18 years and older, and who have experienced a lot of trauma. So when I hear Colleen and others talk about exposed to young, childhood trauma, 1/3 of the men that we serve, actually, about 37%, actually, to be more exact, have been victims of gun violence prior to coming to READI Chicago. And once you have been a victim of gun violence, the chances and the likelihood that you become a victim again is actually 7 times fold, particularly within the first 3 years. But the program in itself is really designed to target individuals, meet them where they're at. And the way that we do that is by partnering with agencies in the communities like INVC, Centers for New Horizon, North London Employment Network, UCAN. These agencies that are on the ground in specific communities like North Lawndale, East Garfield, West Garfield, Austin, and North Lawndale, and using human intel to identify these individuals. We also have a partnership with the Department of Corrections in our Cook County Jail to also, through them, identify individuals who also fit our criteria. And then lastly is through our partnership with the University of Chicago's Crime Lab, who is also helping to use risk assessments and predictive analytics to identify individuals that sometimes even human intel don't actually know who are some of these drivers of gun violence. And ultimately what we do is we saturate them with resources, and the way that we do that is provide an employment opportunity, what we call transitional jobs. And then we also provide kind of behavioral therapy or kind of behavioral intervention. And that really is the model. And the idea is to meet people where they're at and then think about assessing their needs and start peeling away of some of those barriers that many of these men have encountered. The program was birthed out of the spike in violence that we saw in 2016, and it was actually philanthropy and corporations like Boeing and J.P. Morgan Chase who actually invested in this work, including the Sports Alliance, our very own Sports Alliance here in Chicago, investing in our work. What I would also say is that when I think about the coalitions and groups that I sit across nationally, I feel really good that for the first time, this population is being assessed again through the crime lab, through a randomized controlled trial study, so that we can really truly compare apples to apples. Like, are we identifying people who are really the drivers of gun violence? And the answer is yes. And I like to use this cancer analogy. You know, when somebody's been diagnosed with a stage 1 colon cancer, for example, the kind of intervention that a person receives, right, could be from
Well, I am sorry, but it appears that I hope people can hear me. Can the panelists hear me? Okay, Eddie is frozen. We hope to get him back because I want to hear more about the impact of READI and the partner agencies doing this work, which is so, so important. But in the meantime, I'm going to pivot to Eileen. Eileen, it's so great to be with you this morning. Thank you for all you do. It would be just wonderful if you could share what AT&T Illinois, I mean, a real leader in this space and so many spaces. If you could share with us what you're doing around your own employee wellness. We'd love to hear about the philanthropic and other investments that you're making in the community that are trauma informed, that are addressing the trauma that Eddie and Colleen and Inger were talking about. And any suggestions you have for corporate Chicago. We have 100 listeners or more from corporate Chicago itself. So I'm going to turn it over to you, Eileen.
Well, thank you very much, Mark. That is a very tall order. Let me start by saying it's an absolute honor for me to be part of this panel and to be with such respected experts in the field of trauma and resilience. Admittedly, I am no expert in this arena, and I hope today to just provide one perspective of our corporation, AT&T, and the work we're doing to help drive solutions in the 3 areas of focus that you just asked about, Mark. What we're doing in our company, what we're doing in the community, and what we're doing in collaboration with other employers. So first, in our company, Mark, the emotional well-being of our employees is a top priority. And as you can imagine, at AT&T, we have a comprehensive benefits package that's designed to meet the needs of our people, including well-being programs, digital tools, a stress management app that teaches simple techniques for how to build mental and emotional resilience. In addition to that, we have an annual campaign to end the stigma, to foster conversations about mental health, and to really get our employees to focus on caring for mental health as part of the overall well-being, of part of their overall well-being. And I think we're doing a lot to support our employees, and we're very, very proud of it. I'd also like to talk about a second area of focus that we've been working on, and that's the work we're doing in the community. In 2017, AT&T launched an employee initiative called Believe Chicago. Believe Chicago is a program designed to lift 19 neighborhoods on the south and west sides of Chicago that have been impacted by high unemployment and gun violence. These are neighborhoods, if you think about it, these are neighborhoods where our employees and our customers live and work. And our strategy was simple: to take the assets of our company and see if we could help the residents of the neighborhoods. For starters, we're providing opportunity. We've hired more than 650 residents from the neighborhoods. We opened a new retail store in the heart of Englewood, and we've created and supported 40 internships, AT&T internships for students. So we're really proud of the work that we're doing, but we're also committed to giving. I know we talked about philanthropy and the importance of it. AT&T and the AT&T Foundation have contributed more than $7 million to more than 100 organizations that are working to help residents on the south and the west sides. The third area of focus within Believe Chicago that's relatively new is our focus on resiliency. And as we were working in the community with groups like READI, we learned so much about the impact of trauma and the importance of resilience that we decided to collaborate with the University of Chicago medicine with NAMI Chicago and the Kenney Forum of Illinois to bring resilience trainings into nonprofit leaders on the West and the South Side. In addition to that, these three stellar organizations have worked to create an online conference, and we held it last spring on workforce resiliency, designed to help organizations understand the stress of the pandemic and work through it. This is really vital work, and we are so grateful that we have the opportunity to support it. The third area of focus I want to touch on really quickly is the collaboration we're doing with other employers. And this is really unique. Those conversations we were having in the community and finding other employers that did work in the community led us to found the Corporate Coalition of Chicago. And the Corporate Coalition of Chicago is designed as an alliance of Chicago area employers who've come together with a mission to reduce systemic inequities by identifying and implementing new ways to deploy our capital, our capabilities, and our employee enthusiasm. And I want to tell you about one of our major initiatives at the Corporate Coalition. In the fall of 2020, we launched the Chicago Resiliency Network. And the Chicago Resiliency Network is designed to help employers improve their workplaces and create a culture where employees can grow and thrive while also delivering better outcomes. So you might be asking, how do you do that? It's a cohort-based model. It goes over 9 months. And there's really three things that happen. We learn about resiliency practices, we share our experiences, and we take action based on the things we've learned in the series. AT&T participated in the first cohort. They're halfway through a second cohort. And I really think the goal here is that individuals and organizations will be able to grow and prosper as a result of participating in this program long after the series ends. So Mark, in answer to your question, that's a little bit about our approach to our work in the company, our work in the community, and our work in collaboration. And to your last question, what can people do? I'd say, take a look at the Corporate Coalition, consider joining the next cohort of the Chicago Resiliency Network, and understand that there's so much innovative work in this space that's happening and underway in Chicago that everyone can be a part of it. So thank you for the question. Thank you for the opportunity to talk about our work, and I'm really looking forward to the rest of our conversation today.
Thanks, Eileen. And what a great take home. And we're not at take home messages yet, but I think this is a good point to interject this in your remarks. I heard of this three-pronged approach, which actually complements what all the other speakers have said thus far. What we have to do in our companies, our corporations, however defined, profit or nonprofit. I'll include schools in that. What we have to do internally, how we have to take what we do that works well with our employees to the community, the second C. And then third, coalition. Colleen mentioned this. Eddie talked about this. And then again, you did. None of this work that we're talking about, this tough work, can be done in silos. We can't do it individually. We can't expect Lurie to do all of this for children. We can't expect Heartland or Threshold to do this on our own, and especially the corporate response. There is no way that a single corporation or 10 single corporations can take this on. So those three C's, really important take-home message here. I'm going to turn to Inger and then get back to Eddie. Welcome back, Eddie. I hope you can hear us. Okay, good. So Inger, one of the things that I've been thinking about through these first three presentations is we talked a lot about COVID and how for the last 2 years we have been responding, and in our third year still, to this crisis of COVID. But simultaneous to this crisis of COVID are multiple other crises that we are struggling with. Attacks on our democracy, to name one. Climate change, which I know is a huge issue that my staff, especially my young staff, talk about all the time. And of course, racial reckoning and equity and justice, especially for African Americans and other people of color. So I think based on what everybody has said thus far this morning, it'd be really important, I think, for you to share your perspective. As we frame this this moment of multiple crises and how we approach and solve these problems with a justice and, in fact, racial equity lens. And, I also want to just put a shameless plug in for one of my favorite books of the year by my friend Inger here. And I hope that you can address in your remarks somehow your research and the findings from your spectacular book. Nobody Knows the Trouble I've Seen, The Emotional Lives of Black Women, which, as I said, is one of my most favorite books ever. And really how these issues clearly have a racial justice and equity focus.
Yeah, thanks, Mark. I think the COVID pandemic and coping with the pandemic over the last 2 years, and simultaneously the nation's awakening to what has existed for decades, the racial injustice in the world, and the intersection of those two issues has really raised a pivotal moment for our country, particularly in healthcare. Undoubtedly, COVID has challenged the mental health of the nation and the world. Everyone has had their lives significantly disrupted. But to be sure, communities of color have been disproportionately impacted by COVID, and that's been felt in multidimensional ways. They've been more, in fact, impacted by the infection itself, as well as the wide-reaching ramifications of the pandemic, including being in more high-risk jobs, service industry jobs, healthcare jobs, law enforcement, other jobs that did not have the ability to work from home, having to take public transportation, being more vulnerable to being in multifamily or multi-person households where risk was higher due to more people coming in and out of the home, more job insecurity, more challenges with healthcare, and as Colleen indicated earlier, concern about widening achievement gaps. And the list goes on and on of the ways that communities of color have been disproportionately impacted by COVID. As you know, as far as mental health is concerned, while many have experienced new stress as it relates to COVID, for vulnerable populations, COVID stress was impacted by the stress they were already experiencing, the social and economic stress that they were already experiencing on a day-to-day basis, in addition to already having challenges getting high quality healthcare and mental health care in their neighborhoods. And the pandemic simply challenged this system and raised it to the national spotlight. Colleen mentioned earlier, and I want to kind of re-raise this point, that so many people with mental health need, there was already not enough available services to meet that need. And in general, whether it be children or adults, oftentimes those that have mental health needs are not going to the service providers, not going to people like me at Northwestern, but rather are staying in their communities. And so it's important for us to go into community in order to be able to meet that need. The pandemic really uncovered these disparities in healthcare, in general healthcare and the mental health care system specifically. And now, while more people have identified a mental health need, the system, there are not enough providers in order to be able to meet that need, and particularly providers of color, as well as providers who are culturally competent in order to meet the needs of the diverse populations that are experiencing stress and trauma and the like.
Yeah, thank you, Inger. And I do want to swing back to that in a little while because I want to hear from your perspective and want you to think about this before we go there, is what are the opportunities being afforded now by new investments from the city of Chicago, Mayor Lightfoot's investment in mental health, especially in communities of color, and other sort of structural interventions and interventions through schools or universities to increase the supply. We know there's a demand for providers of color, and how are we going to increase the supply both on the private and the public side? So Eddie, I'm going to swing back to you though, because I think we'd like to hear a little bit more about the impact of READI and programs like READI, and specifically, how are you working with the city of Chicago and other entities to reduce gun violence in particular?
Yeah, so before I answer that question, Mark, let me give the audience a quick snapshot of who it is that we're serving. I think it's really important because too often when we hear in the news about a certain person or a group of people getting shot or shooting others, it creates a sense of panic across our city and our suburban communities as well. But we also know, not only here in Chicago, in most cities, gun violence is very concentrated, and it's concentrated in poor Black and brown communities for the most part, communities that have been grossly underdeveloped, underinvested for decades. And that goes from the school systems to other areas as well that we already have spoke on. But we've been able to serve about 1,600 men in Greater Chicago. Out of the 1,600 men, over 900 of them, we've been able to provide the full dosage of Greater Chicago, which again, it's workforce, it's kind of behavioral therapy or intervention, and it's other support services like housing or individual mental health or family supports. 80% of our men, and we believe this number is actually much higher, but about 80% of our men are in Greater Chicago, based on police and hospital data, have been victims of violence. They've either been shot, stabbed, or assaulted. About 90% of them have had a family member lost to violence. And like I said earlier, about 37% of the men that we serve are survivors or victims of gun violence. We also know that 60% of our men have done prison time. And on average, they have 17 to 18 arrests. The last thing that I'll say, this is really important for your audience to know as we think about solutions. 80% of the men that we serve have only completed a 10th grade level of education. But through tape testing and focus groups, we know they're reading at a 5th and 6th grade level. Those by far are the individuals that are getting shot or shooting others. And so I want to leave that for the audience, because the kind of intervention that is needed for this particular population has to be very different in the way that we look at youth or that we look at other populations as well. And I'm hoping we talk more about that in just a second. But here's what we're also learning. We also know that relationships do matter. We're seeing a decrease in victimization with participants who are engaged in the program. We believe that while the study is still ongoing, and in 2 months or so, the University of Chicago Crime Lab will be producing the report. We know that the impact of CBT or CBI is actually having a reduction in their behaviors as well. We know that to be true. And so there's more that I could talk about as it relates to that, but the things that we're learning about READI, it's really helping not only inform our field here in Chicago, but the national field. I mean, we met with the President of the United States already a couple of times this year. The Attorney General of the United States, Mark Garland, has visited Greater Chicago back in July, and that was following a massive shooting that we had in North Lawndale. That was less than 24 hours where we had 2 major shootings, each shooting of 5 people. One of them being a participant in Greater Chicago, being grazed in the forehead, and the next day being in the program for CBT. That should tell us something there, that these men are actually want these services, but we also have to meet them where they're at. And as it relates to your question around government, particularly here in the city, we have a small, grant that we get from the city. 90% of our funding comes from philanthropy. That's not sustainable, to be quite honest, Mark. It's just not. We've done this investment from philanthropy, which is close to $100 million, was to be able to test something different in this field, to test what is working, what's not working, to help inform the field. But now we need government to step up, and we need more corporate sponsorship to step up, like AT&T and Boeing and JP Morgan Chase. By some examples, we need that community to step up as well. But again, the work that we're doing, the results that we're seeing, the impact, the lessons that we're learning is helping to inform the field, and we need city to also invest in this.
Thank you, Eddie. So another thing that has come up for the last 40 minutes is underinvestment or lack of investment. From my perspective, running Threshold's a very large community mental health organization, community behavioral health organizations, both mental health and substance abuse treatment agencies have been woefully underfunded for decades and even longer. The rates and reimbursement that we get to do the work simply does not cover the cost, which has led in our field to huge problems with recruiting and retaining staff, morale, as you can imagine, the quality of services, and the inability to take in any new clients. But because I'm always hopeful, without being Pollyanna, but always focused on solutions, there is a potential solution for the community behavioral health space right now that we're working on. And a bill introduced a couple of weeks ago by Illinois House Majority Leader Greg Harris, which has, I think, as of this morning, 69 bipartisan, widely bipartisan support. is for a bill called the Rebuild Illinois Behavioral Health Workforce. And folks, this is a game changer. I should say, when this passes the House and the Senate and signed by the governor, we have a lot of work to do and a lot of people to work with. But I remain very hopeful because of the strong bipartisan support we have. This will be a game changer for community behavioral health. Will allow us to invest in staff to recruit and retain the very best, to allow us to open up doors again. And this small investment of state resources combined with federal Medicaid match actually saves the state so much money. While I'm always focused on what we can do to improve care, we do have to think about the value proposition. And by reducing incarceration, by reducing hospitalization, by reducing long-term care, nursing home, and other long-term care, and keeping people in the community where they can recover, it's so exciting. But to me, this is an example of a big systemic, structural, political intervention that is needed, at least for our population, to serve the most vulnerable. So I'm curious from any of you all, are there any structural or systemic efforts that you're working on in Chicago, at the state level, at the federal level? Also for us at the federal level, we are working to expand what are called certified community behavioral health centers. And this is federal funding and support for community mental health providers, equivalent to what our our amazing FQHC partners get. And I think this is sort of the movement toward creating what will eventually be truly integrated, holistic, physical and mental health care. But it requires parity. It requires parity at all levels, and especially parity when it comes to public investment. So I am turning back to the panel. Any structural, systemic, political solutions that you're focused on or working on, or that we need to start working on?
I can jump in here,
Awesome.
Mark. I'm currently leading a 5-year randomized controlled trial that's funded by the National Institutes of Health to implement culturally competent mental health services in community, particularly in federally qualified health centers, which serve majority minority populations, and particularly those that are low income and living at or below the federal poverty level. One of the things that I'm really excited about in terms of this work is as a part of the project, we're training people that are in the community that are already staff within health centers to be able to deliver these evidence-based interventions. And, as has been mentioned many times in our discussion today, one of the key aims of the work is going into community and meeting people where they are, rather than waiting for them to come to kind of specialized and sometimes scary, stigmatized mental health service system settings. This is work that we have the goal of being able to roll out even more widely across federally qualified health centers in the city and in the region. And I think that it's really aligned with some of the work that Colleen is doing, that Thresholds is doing, that READI is doing. And even as Eileen has mentioned, again, this idea of how we can bring treatments that work, that are specifically tailored to meet the needs of individuals with the highest need in community.
That is absolutely fantastic. Colleen or Eddie, any big structural education, violence reform efforts that we need to know about?
I'd love to jump in
first,
because I've got lots of thoughts here. I think one really important message for this audience today is to know that what Eddie and what Inger are talking about and what we are doing at our center, we have the answers for how to do the best practices. There are great solutions out there, and folks have been really elevating that mental health needs to come under the same scrutiny as medicine. We need to do what you heard today. You've heard the phrase evidence-based and randomized controlled trials. I mean, we are trying to apply the hardest scrutiny to mental health that we can, so that when you are using your mental health dollars, whether that be private or Medicaid or through philanthropy, that we at least know that people are getting services that work. So I think that's really important for people to know. We have the solutions. I think the sad part is that while we have the solutions, we don't have the workforce and we don't have the long-term investments. So I think what we're talking about today is sort of where is that coming from? Where do we start to build these investments and build a workforce that's going to meet the needs going forward? And I think a silver lining of this pandemic is more people are wanting mental health access. A very quick example of a solution that happened quickly is the move to telehealth. Many of us have been advocating for that for a very, very long time. And we thought we had years and years of battle to get that to happen. It happened overnight. And if we're not careful, it's going to go back again because insurance companies are fighting it. A lot of people are saying we don't need it. The fact is, we do need it. It's not the right solution for everyone, but it does increase access. So that's important. The second thing that we know is that that access has to be to clinicians that are culturally competent. And one of the great things I can tell you from working with young people across Chicago is the young people want to be involved in mental health. They don't have the same stigma. They want to talk about it. They tell us all the time. These are conversations they want to have with adults, but the adults, their parents, their teachers, their leaders in their community don't want to talk about it. So we have to follow their lead. We can follow their lead on a lot of things around, racial reckoning and all kinds of things, the climate. But this one about mental health is really important because I think if we build the infrastructure to support pipeline programs, we're going to have those young, bright people who say, I want to be in the field of medicine, say, oh, mental health is cool. I want to do this. I can serve my community. And we see that happening every day when we work with young people in our city and our state. So I think that we've got it. I think the workforce work that Leader Harris is talking about is critical. There's legislation to create a behavioral health workforce center, and it's modeled after one in Nebraska that was very focused on psychiatry, which is a clear need in our country and certainly for child psychiatry. But what's so cool about the vision here in Illinois is it's going to be much more comprehensive. And we're looking at things like Ingrid just said, those community health workers, those trusted people who knock on your door, who can come and tell you, yes, you should get your vaccine, and here's how you protect your rights, and how are you doing? And do you know where to get mental health services if someone in your family is hurting, right? So changing that lens and saying, we need a workforce that starts with pre-bachelor's level folks, and the community colleges are interested in supporting this kind of a certification. We're seeing it in Malcolm X and Truman. Let's get folks involved early, pre-college even, and get them out there communicating. And then we start to build forward these careers. But we also have to, as you pointed out, then invest in the salaries. Because right now you can make more money at Starbucks or Walmart than you can as a social worker in many parts of our state. So that's not going to keep the youngest, brightest people doing this work. So we've got to invest in those salaries and those structures to support the innovative kind of work that's really going to be cultural. I'll just put one plug in to just give you some happy news. We are launching a really exciting project this morning that's called REACH, Resilience Education to Advance Community Healing. This is a work that was modeled from Chicago Public Schools. Chicago Public Schools has taken every grant they could possibly get and built an infrastructure to say schools have to address social emotional learning. We've done it in interesting ways. There's been partnerships with all the players that have been mentioned today, all the community partners pushing in and saying, how do we identify what kid needs an intervention as soon as possible, get it to them through schools? And it's been supported by philanthropy, by grants. And what I can tell you is that this model, this healing-centered approach, is starting to be recognized across the state. People who used to say, we don't need this. We don't have these kinds of problems. Well, guess what? Between opioids and the pandemic, no one's saying it's not my backyard anymore. Everybody is saying, I need this in my school and in my community, from rural Illinois all the way up. So we're going to have 855 schools enroll in this REACH project. And we're going to be able to help them figure out what are their needs to support their students. How is it this trauma and the stress impacting them and the students and the teachers? And how do we build their capacity to do that? And we're going to give them credit if they do it. The Whole Child Task Force is a pretty exciting thing that came out of the Black Caucus. And they are saying, if schools do this, we're going to highlight them. We're going to give them extra resources. We're going to support them. And we're going to shout out so that the state of Illinois is actually a leader in creating healing-centered schools and communities that the rest of the nation can follow. And we need the federal dollars, we need the philanthropy. It's been great braided funding up to this point, but ultimately we need the systems to pay for these supports so that it's built into how we do business every day. But there are options. There's a lot of smart people coming up with solutions. So we got to invest in them, both the short-term innovation and the long-term sustainability, and we can make this work.
So,
Well,
Mark,
thank
I
you for
wanted to
that.
jump
So
in.
exciting. Yes, please. Absolutely.
Yeah, just briefly, just so I want to make sure we're giving time for some questions right from the audience, and but to your question, one of the things that excites me, and I'm very similar to you as the folks in this call, is that we tend to be very optimistic, right? We see so much hope, right? Even when in the light of like when there's darkness and so on. And I remember back in April sitting in the Rose Garden with the president when he made this 5-point plan around gun violence. And he was investing just in the Department of Justice $1 billion, right, to support gun violence efforts. And right now, through the Biden Build Better plan, right, and hopefully if Congress passes this, so for our listeners, if you want to be an advocate around this, here's some of the work that coalitions like the Phone Peace Coalition and Heartland is supporting this kind of work. We're helping to inform the president on what are those best practices. How do we target and support gun violence efforts? And if you look at his 5-point plan, part of that plan is to invest over $5 billion in the next 10 years into the space of gun violence. We know thus far that if this plan gets passed, 2.5 will go with 2.5 plus will be going to the Department of Justice, and the other half will be going to the CDC. We're starting to see those RFPs come out right now through those two federal agencies. So organizations that have been depleted from resources, right? These dollars are to some extent being helped to build capacity with these agencies and to allow us to be more creative in the space of mental health, for example. Colleen mentioned the need of building this field, right? I will tell you, when I was asked 5 years ago by the board at Heartland, and they said, Eddie, what do you anticipate being the biggest challenge? I remember standing there and saying, like, we don't have a field. We don't have enough outreach workers. We don't have enough clinicians to support this population. And I said the same thing with Tom Ricketts from the Cubs about 3.5 years ago. Like, we don't have a farm system. And so the opportunities that we see, and this includes the governor who just announced 3 months ago or 2 months ago, this new office of firearms investing $250 million, from ARPA. Like those are some dollars that's going to help us stabilize, right, and build that capacity. But let's not kid ourselves. Like that's a starting point, and that's short term in terms of that investment. We still need other partners to step in to say, where do we need to step in? What are the areas that we could change some of these policies? How do we build structural systems, right, that's going to last us 5-10 years ago? Because we don't know if 2 years from now, 20 years from now, it's going to be another pandemic like this. And when we wrestle with the issue of criminal justice and we issue around gun violence, let me tell you, I've seen so many people who have been, left wing and being more empathetic are saying we should hire more police. We should do X, Y, and Z. And the truth is, we do need law enforcement, and they're part of the solution. But we need the community. They need to be invested, right? We need these kind of services, right, to also adhere and to be supported to the things that we're trying to do as a collective. Really building an ecosystem.
Yeah, thank you for that. So I want to swing back for a moment to the workplace, Eileen, and for everybody, since you all work or run major programs in major workplaces. So much of this is about the workplace. And there's questions from the audience and from the questions committee about this connective tissue between mental health and productivity, employee engagement, and the business case, actually. I think we're in the moment right now. Everybody's talking about the Great Resignation. I want to try to reframe that to the Great Recommitment and everything that we need to do to recommit ourselves and our current workforces and figure out the resources that we need to bring in the new folks. But I really would like everybody to talk for a few minutes about this relationship between mental health, I should say, productivity, engagement, and what that means for making our businesses, if they're profit or not profit, work. So I'm going to start with Eileen and then ask the rest of the group to please chime in.
Mark, I think for AT&T, the connective tissue is our focus on nurturing the employees' total well-being, right? So we're focused on taking care of our employees so they're going to be best equipped to take care of our customers. And what this requires is for us to have a focus on meeting employees where they are, right? So offering benefits that assist with their emotional, their spiritual, their financial, their physical, social well-being for both them and their families. And so that might involve expanded EAP programs. We've introduced caregiver leave. We've expanded or introduced more than 13 well-being programs in the last year. So for us, it's that idea of taking care of our employees and their families first. They can then bring them best selves to work. And then I think we're taking care of our customers to the very best of our ability. So that's what I think at AT&T we view as the connective tissue between all of this.
Yeah, thanks for that, Eileen. I mean, I totally agree. I mean, there is no way we can take care at Thresholds of our 10,000, among the most vulnerable people in our state, if we do not take care of our staff. I sometimes feel like my singular focus is making sure that our 1,200 staff get the remuneration, the benefits, the policies, the internal programs to support them to be their very best. We do a lot of the same things that you talked about. We have made Juneteenth, for example, a paid holiday coming up this June. We've incorporated commitment to DEI and justice work into everything that we do that I think is really important to our staff, to their mental health, knowing that we are so focused as an organization and in the community on racial justice and equity, and a panoply of other things. And communicate. I think more so than ever. I've been doing this work for, I don't know, nonprofit work for 35 years. That's how old I am. And I have never communicated more. Whenever I say we need to communicate with our staff, then I say we need to do it even more and better. I also need to know how to communicate in non-email ways with younger people that don't want to communicate via email. So I'm learning a whole bunch of stuff as well. In addition to all the things of pay and benefits and time off and support and EAP, I also think that it's just so important to remind our teams how much we value them, how important they are, and how much we cherish them. I use the word love at Thresholds. I mean, I love my employees. And I tell them that all the time. I'm not sure that people want to hear that, but I do. I feel such deep love for the folks doing this hard work. And that's important to let people know as well. Because my experience is that people, in addition to all the stuff and work-life balance and access to EAP, they want to feel valued, they want to feel heard, and they want to feel loved. So other folks, from your workplace perspective.
Mark, I was going to say, I feel very grateful for my team, right? And I try to express that gratitude in all that I do and how I communicate with them. But I love how you've just explained your approach at Thresholds. Thank you for that.
I would also say, Mark,
you got it all.
Yeah, I mean, the funny thing when you said the word love, right? I literally love my team. I really do, because they're committed people, and I mean, they've been to my home. There's things that I do, right? Not just to build morale, but to express gratitude for their sacrifice, because the truth is, they're supporting so many other staff on the ground who are seeing a lot of trauma. You know, I mean, for example, I got a text just a little while ago that there was an outreach worker in Baltimore, just 30 days in, was shot and killed, right? And we've lost staff to the streets. Like we've had outreach workers shot. You know, we've had participants, you know, act out with our staff, right? When I heard you say about vulnerable populations, I mean, the people that we serve, right? They're vulnerable. There's acute needs that they actually have, and if it's not us, then who else? Because when I heard Colleen talk about de factos in schools for mental health, the same thing for prison systems. The prisons, the jails have become de factos for mental health as well, and they're not getting the care that they need there. So when I hear you say the word love, right, it's like, what more can we do, especially during this pandemic, right, to support them, to validate them, because we're burning them out too. And that also brings me to this one point. that we got to do a better job. The field in itself, government, philanthropy, to allow us to build a stronger field, right? To invest in the back office as well, right? To invest in the leaders, the middle managers, because the hope is that they replace me and replace others like us. And so we have to be intentional around that too. And I think that's another way that we express our love when we see our staff, right, being promoted or going to other organizations to lead other efforts, right? And that's also a tribute to your leadership. And so just wanted to express that as well.
Thank you, Eddie. So,
and I would just add to that, Mark, I think the notion that we are hearing is that for every human service agency in particular, but all of our workers, that this idea of work-life balance has just been so complicated. And so I think it's really important that loving on your staff is important, encouraging them to take balance is important. But the other thing that we need to remember is that self-care really can start to feel like you're putting the onus on the employee to take care of themselves when maybe the system and the structure they're working in isn't adequate to support them. And so I think it's really important that we expand that notion of self-care to really think about the notion of collective care and how are we creating that. And I hear that in all of the words that you all are using. It's listening to our employees and figuring out what will help them to bring their best selves to work. And it's also acknowledging the isolation and loneliness and the impact. We cannot get off this call without acknowledging that the rates of suicide have gone up significantly across all demographics during this time. And we know that people are really hurting. So it's not just putting things in place. It's forming those relationships. It's checking in with one another. It's asking people what they need, listening to what they need, and connecting them to those services, because it's not enough to take a bubble bath or drink some hot tea. If you're working in a system that expects you to give 250% 7 days a week and take care of your family and your loved ones, it's too much. So we gotta really think about, as leaders in this call, what are we doing as systems to really put that into action so that it's not just the individual, but it really is a collective response for taking care of one another and bringing out the best in everyone. So I think that's really important.
Yeah, I could not agree more. Though I think we are going to have a quick round robin before we have to turn it over to David in less than 10 minutes, because I do want to hear what your self-care regimens are, because I think they could inspire some of the 200 folks that might be looking for some tips. But it's not about self. It's about the collective. And so I so appreciate you saying that. Yeah, I mean, the distress and the trauma that we are collectively suffering is in some days it feels like it's just off the charts. You mentioned suicide, the opioid epidemic really has decimated communities here in Chicago and throughout the land. We actually just got an interesting question, Colleen or Inger, you may want to answer this, from Monique Jones, a good friend of ours from Forefront, is talking about the impact of COVID on domestic violence and elder abuse and child abuse, in fact. Any insights into both the challenge there and what specifically you would recommend as potential solutions? Inger or Colleen, would you like to take that question?
I can jump in. I'll jump in and just say again, the isolation factor, I think, is something that we need to address. What we know is that for many victims, they don't have the social connections and opportunities to share the distress or the stress that's happening in their households. So I think what I would just suggest is that use whatever strategies you have to create safe spaces for folks to let you know if they're hurting. I know educators have come up with red flag systems. So a student can just say to the teacher that they, put up a little flag that says, I want to talk to you after class, right? So creating those quiet moments when people are doing things like Zoom learning, there's often not privacy. So we need to be thinking about those relationships. So I would say this is a spot where addressing isolation. I know we have issues around safety and gathering, but try to check in on the people in your circles and check and see how they're doing. Try to open up opportunities where they can express their feelings so that you can connect them to the services. But we are seeing that it's a very real problem.
Inger or anybody else?
Yeah, I think, just to briefly add on to what Colleen has already mentioned, the increase in domestic violence as well as substance use can be directly linked to the increase in stress that so many people are experiencing and the disconnection from some of the resources, both formal mental health resources and substance abuse resources, as well as informal supports and outlets that people might have available in their day-to-day lives. So, definitely seconding the strategies that Colleen already mentioned in terms of as much as one can, being able to utilize and lean on those social support systems, both the individual that might be the victim of domestic violence or who might be struggling with a substance abuse issue, as well as those community and family members being sure to check in on folks.
Mark, could I just add, I think it's so important that we recognize we don't have any idea what people are coming to work with, right? And what's impacted them in overnight or in what's happening in their home life. And trying to understand that for our employees is so critically important. And I'd say for leaders, take a chance. During the pandemic, Kennedy Forum of Illinois offered some trainings for our organization that we signed our team up to learn. And I didn't know how our team was going to react. And we did that across 5 states. And the response I got was remarkable. And there was content in there of how to manage stress, how to deal with suicide, how to recognize opportunities to grow and learn around your mental health and find resources. And I just think I wasn't sure how my immediate team was going to react to all of that. And the feedback I got was tremendous. And we actually then instituted a wellness program where we were doing regular communications around ideas and wellness, not just mental health, but again, that whole well-being. So I just think there's lots of opportunity here for people to learn and grow, and lots of space to create for the conversation that each of us, whatever that sphere of control is, has some responsibility to recognize and create opportunity for dialogue.
Yeah, perfect. So we have 5 minutes before I turn it back to David. So we're going to go around and we have 5 people, 5 minutes. We're going to take about 30 seconds for what you do for self-care. And 30 seconds to make any last minute recommendations or suggestions to the esteemed group of listeners and those who will listen to this on YouTube whenever they have an opportunity. So I'll just start by modeling this. I try to do self-care every day, Qigong and meditation, which I'm not very good at, but I really try hard. I get walked by my dogs twice a day. I am a photography buff, and I post said photographs on all social media all the time. And I am an avid fan of the Economic Club of Chicago's member exchanges and do them on anything from Dolly Parton to the best movies in the world and meet a lot of awesome people. So that's what I do for self-care. And my recommendation to the listeners is do anything and everything that you can do because every little bit and every big bit helps. Donate, volunteer for your favorite organization or one that you haven't volunteered for. Join a board, and for the young people out there, the junior boards. And finally, I'm all about action. So if any of these great organizations that you're involved with have action alerts that you can sign up for to respond and get involved in really important systemic structural change, we need you. So we have 4 minutes, and Inger.
So for me, mindfulness is a practice that I really integrate into both my research and clinical work as well as my personal life. And, specifically what that looks like for me is intentionally slowing down, intentionally checking in with myself, checking in with my team, in doing so in a moment by moment basis. There's so much happening in the world, and our minds and bodies are responding to it. And I think we owe it to ourselves and our families and our communities just to really be aware of that, because that awareness empowers us with the ability to take better care of ourselves and take better care of our loved ones. And to add on to this, you know this, Mark, that I'm an avid yogi. And so keeping up with my yoga practice, which I have to admit, has waxed and waned over the pandemic, but it's something that's always, chiming in the back of my mind, just to make that mind and body connection and take that time for myself and that physical practice to regulate the way that stress shows up in the body. In terms of my recommendation, again, building upon that mindfulness, paying attention to the people around us. Colleen mentioned the rising suicide rates. We have all well heard about increases in depression and anxiety, not only in our employees, but in our children and just in the broader community. And we need to slow down and pay attention and listen, beyond a simple, how are you today, without listening for the response, but really attending to people, holding space for people, and taking the time, if you're able, to connect them to the resources that are available.
Awesome. Okay, we have 3 minutes. Round robin. Eileen.
Well, right now it's hard for everyone, right? It's hard. It's not easy for anyone. It's even harder for some. For me, I find that I'm best when I prioritize family, faith, and fitness. And I don't know if that's self-care or not, but what does that mean for me? I'm just really happy at our company. There's been this really continued emphasis on encouraging us to take care of ourselves and our families and each other. And what that's allowed me to do is set some boundaries that, quite frankly, over a 25, 30-year career, I was never setting. And so I have found over the last 2 years great benefit and blessing spending more time with my family, my husband, our 3 teenagers. I'm not sure the kids see the same blessing that I do and how much family time we've had, but it rejuvenates me every day. So and now my focus, Ingrid, your point, is being more intentional about how we spend that time, as they're going to be, leaving in 4 years. My faith also means a great deal to me. I'm Catholic, and I try to find time every day for daily prayer, for spiritual growth, and I get great strength out of attending Mass. So that's another piece for me. And fitness. I'm a retired runner. I love to walk. I love to walk in the woods in the Cook County Forest Preserves near my house, and I get great energy, solving problems, clearing my head, praying, doing whatever I need to do in the woods that day, in the fresh air and the sunshine most days. So that's how I try to take care of myself. And my advice for everybody is really kind of simple, and I don't think it's very corporate, but it's really just striving to be your best self every day and bring that best self to everything you do, to every encounter. And to be that best self, I think you have to find what gives you joy and just keep doing more of it as often or as frequently as you can. And when you fall down one day, get back up and try hard again to prioritize those things that matter to you the most. So I think that's my call out there. And from a corporate standpoint, think about the coalition, think about the Resiliency Network. But that's my best suggestion, Mark. Thanks for the opportunity.
Thank you. That's just awesome. And Eddie and Colleen, bring us home. I know David is scrambling to get on here so we can end, but I'm not going to stop until you guys chime in.
Oh, good. So I would say on my end, I'm probably the least person that could, really answer that question. I have a lot of bad habits. I would say that after spending over 14 years in prison, that, I'm very grateful for what I have. So when I look at the work that I do, I connect it to my faith. Similar to Eileen, I'm an Orthodox Christian, and so I'm so honored to do what I do and practice my faith by doing what I do. So prayer is really important for me. Service throughout the week is really important for me, and it's just a reminder, right, that I'm on borrowed time, and that if things would have changed in my life, I would have probably still been in prison or dead. So I want to maximize every opportunity, which is why I don't practice the kind of self-care that I should. But when I do, this is what it looks like. And this is what I would say. Besides, in addition to my faith, I have 7 beautiful children. They're all under the ages of 8. And I spend as much time as I can with them. And I have a couple classic cars that I work on. And then I take my girls cruising around your house, Mark, around the park. So that's my self-care. I would encourage that. Build memories with your kids, because we're not always promised tomorrow. And I just, at the very least, hope that the impression that I leave with my kids is grounded with my faith, but also the example that even people who made mistakes in their lives are redeemable.
Awesome. And Colleen?
I'll go quickly. I try to seek sunshine and joy every day. So I try to get outside at some point with my dog or something before the sun sets. I also love, people who know me know I drive a convertible, and that is great self-care when I can put the roof down and put music on and just smile and laugh. And music is great. And the last thing I would say in terms of to the members is step up and step in. There's so many ways you can contribute, and love on the ones you love and be there and take a risk. There's a lot we can all do together as a powerful city.
Perfect. I love you all so much. Thank you for the most spectacular hour and 15 minutes of my week. And now, David, thank you. Take us home.
Great. Mark, thanks for doing just such a wonderful job leading the conversation. And to all four of our panelists who were insightful, I learned a lot today, and I hope those of you who are watching did as well.